It's our fourth class in quantum psychotherapy. We are finishing our second weekend, and we are still on the topic of how to work quantumly with our clients. And our topic today is assessing clients' needs and developing a quantum-informed psychotherapy treatment plan. So we will explore how to do a quantum assessment of a client's needs, do a treatment plan based on observation that is a shift from linear, static, traditional diagnostic symptom-focused models to a dynamic process, an energetic assessment focused on observer effect, interconnectedness, and fluidity of reality. And on the client's biofield, behavioral patterns, emotional states, and non-verbal clues, that which they are not saying, but we can see beyond the physical into the energetic world. So a client in this model of the psychotherapy that is quantum is viewed as a holistic system that seeks to identify and correct imbalances in the body's energy field. That interconnected system of energy, consciousness, and information, and energy, consciousness, and physical health are deeply interconnected. And your observation has to detect energetic signatures, behavioral patterns, and conscious blockages so as to aim at rapid transformational change, which is known as quantum leaps, rather than just incremental progress. And observation is used not just to categorize symptoms, but to shape the therapeutic field and identify quantum signatures of distress that the client is presenting with. So, incorporating quantum principles, you as a therapist can develop an effective treatment plan that addresses your client's unique needs and promote profound healing and growth, shifting the client's state of being by recalibrating their bioinformation field to match a desired health outcome. So when conducting a quantum assessment, as a therapist, you look beyond the surface symptoms to identify deeper energetic patterns, subconscious projections, and the potential for rapid transformation. And rather than just focusing on cognitive narratives, as a quantum facilitator, you approach priorities and you prioritize the body as a database of experience. And this includes asking where the client feels any physical sensation of an emotion in their body. And as a therapist, you have to also monitor changes in the client's energy levels or field during the initial intake. And you watch out for signs of releasing trapped emotional energy like trembling, like yawning, or sighing, as these are signs of progress. So quantum assessment looks for defensive strategies and projections. And this is how a client treats their reality through unconscious projections. So identify those habitual defensive strategies, how the client defends against pain by intellectualizing, blaming, or shutting down. And determine the client's projected reality. That is how the client's current worldview is based on old personas or past traumas. And also observe the client's reactions to quantum questions. How a client responds to questions like, what are you experiencing right now? Or, how is this situation familiar? Often these questions reveal immediate, unconscious, defensive strategies that the client has been holding. So, as therapists, we have to be mindful of the observer effect in therapy. which is an active participant in the client field. And the intention set by both you and the client impacts the therapeutic outcome. So you have to access the relationship and coherence, the relationship between you and the client and its coherence, and the level of rapport and the coherence between you and the client, as this facilitates deeper healing. So recognize that your presence and the act of assessment itself influences the client state. So the question you ask can collapse the client's multiple potential mental states into a single experienced reality, a new outcome that can heal. So as regards transformation and time, quantum psychotherapy aims to bypass long linear therapeutic processes to foster rapid change, those quantum leaps. So look for the client's ability to shift perspective, superposition, and the capacity to hold multiple possibilities simultaneously. So look for the reconsolidation of memory, signs that the traumatic memory is being rewritten or upgraded with new safety information. So be open to instant repatterning and rapid shifts in perception or emotional state that occur within a single session, and especially during the intake session. And you can use quantum questions to reveal deeper information, such as exactly what was happening when you started seeing the world this way? Or when did the version of you emerge that experiences the world this way? Or how is it that how is this situation familiar? And these questions look for those recurring energetic patterns. You could also ask, where are you experiencing this feeling in your body right now? And this question anchors the client in the present moment of the now. So while exploring quantum or energetic states, ensure that the client remains anchored and grounded in their body to avoid dissociation. And somatic anchoring can be done. So instead of just intellectualizing, ask questions, those quantum questions that root the client in the present moment of the now. That is what somatic anchoring is all about. For example, where are you experiencing this feeling in your body? Or what are the specific sensations you are feeling right now? So you are also assessing interconnectedness, how the client's environment and interpersonal entanglements influence their internal state. And always screen for safety and suitability and standard clinical risks, such as a potential for harm or psychotic tendencies, alongside quantum specific assessments. So let's look at the specific quantum questions you can use during the initial intake. And these are designed to move beyond what's wrong, to explore the client's current energy state, somatic sensations, and potentialities for healing. And they highlight the fluid nature of their reality rather than reinforcing the client's static presenting issues. And the first batch of quantum questions looks specifically at somatic and real-time awareness. And these questions root the client in the present field of the session. And there are 4 questions. Are you, as you describe that situation, where are you noticing a sensation in your body right now? If that feeling had a color, if it had a weight, if it had a vibration, what would it be? What are you noticing in your environment right now that makes you feel grounded? In this exact moment, what is the energy of the room like for you? Another set of quantum questions assess the potentiality and position. And these questions explore the client's multiple potential states, challenging a fixed identity. And there are also 4 questions. And they go like this. If you were experiencing this problem now, what version of you would be standing in its place? As you were experiencing this problem that you presented with today, what version of you would be standing in its place? Second question, imagine waking up tomorrow and a miracle has occurred. What is the difference noticed that life has shifted for you? Third question, what are the 3 things you value most about yourself that exist even when you are struggling? Last question. If you could step into an empowered version of your future self, what advice would that future self give you today? The next batch of questions is meant to assess the observer and the belief interrogation, and specifically how the client's observation and perception shapes their experience. And the first question is, how might your current belief about this situation that you are going through be acting as a lens that colors what you see? Second question, what story do you tell yourself about this failure? Is there another version of a story that is also true apart from failure? The third question, if a trusted friend were looking at your life now, what strengths might they see that you have been overlooking? The fourth question, are you willing to investigate any subconscious patterns that might be interfering with achieving of your goals? The last batch of questions has to do with connection and entanglement, and they explore the client's interconnectedness with social and environmental fields. And there are 3 questions. And the first one is, who in your life replenishes your energy? And who in your life feels like they are draining or depleting your energy? The second question, how do you feel your current environment, your work or home space, how is it impacting your internal state of mind? And the last question, when do you feel most connected to the world around you? What are you typically doing when that happens? Now let's go through a quantum client assessment checklist, a summary of all that you need to look out for. And the first is to assess the therapeutic alliance between you and your client. And you are asking yourself, did I establish a warm, empathetic, and supportive environment for my client to open up and share? And the second on the checklist is assessing for the observer influence. And you ask yourself, am I aware of how my presence, my culture, my nonverbal cues as a therapist shape the way the client responds. The third on the checklist is internal intuition. And you ask yourself as a therapist, am I paying attention to my gut feelings, to those intuitive prompts during this intake process? And the fourth on the list of the checklist is the current presentation. And you ask yourself, how am I presenting myself in front of my client? What could those observed habits be? Those tendencies, those behaviors, those physical expressions during this session that might interfere with the client response. And next on the checklist, you are now assessing for vitality levels of your client. So you are assessing the physical health of the client, the sleep habits, the exercise, as this indicates the overall energy of your client. Next on the checklist, you are assessing the non-linear history. And here you are identifying those precipitating, those predisposing, those perpetuating, and preventive factors that created the mental patterns that the client might be experiencing. The next on the checklist, check out for the strengths and protective factors. What are the client's internal resources? Those high points of engagement and positive values that exist as potential for their change. Next on the list, the social landscape. Assess the current state of family, friendships, and mentors. And that is the relational entanglements that the client has with the social world and with home. Next on the list, you are assessing for the spiritual and cultural practices and beliefs that the client wishes to incorporate into the quantum field of therapy. The next on the list is the environmental context. That is the impact of the events, situations, circumstances, people and places, housing, finances, and work on the client's internal reality. And as you are ending your assessment, make sure you do the risk assessment. Those denied or confirmed suicidal, homicidal ideations and history of self-harm. Also assess for substance use. The current and past history of alcohol or drug use as a management strategy. And also assess for the psychotic tendencies. Screen for thought disturbance or perceptual abnormalities. And as you are doing this assessment, there are important considerations that you'll need to take. And the first is the ethics. You have to ensure a transparent communication about the nature of the treatment, as it is a complementary approach. 2, safety. Work under the guidance of a certified practitioner, especially when dealing with severe emotional or mental health issues. And third, engage the client in the planning process. It has to be collaboration so as to improve their ability to adhere to the program. So as we conduct this assessment, it has 3 phases. And the first phase is the energetic assessment. The second phase is when you have to define the problem statement. And after that, you go on to developing a quantum-informed treatment plan. And for future, you prepare for a monitoring, evaluating, and adjusting your treatment plan as the initial issues get to be resolved. So let's look at how to do this assessment. And we begin with active observation and energetic assessment. So here you are identifying the energy patterns instead of fixed pathology. And you are looking at the physical appearance and movement, and you are identifying the quantum signature, the physical sign. And under this, you have to look at the physical body not as parts, but as condensed energy. Observe the posture, observe the gait, the skin tone, and the vitality, and ask, is the energy vibrating or sluggish? Is the client's posture collapsed? That is, are they in low frequency? Or is it rigid? Are they in high resistance? Does the body appear radiant, coherent, or does it appear fragmented, chaotic? Then you have also to access their communication style, and you have to notice the language patterns, the positive and negative, expansive or contracting language. Listen to the tone behind their words, not just the words themselves. And sense the client's aura or biofield, not areas of tension, areas of coldness, or areas of heaviness. And assess the client's quantum memory. Those traumatic events often leave an energetic imprint in the client's field. You aren't just looking for the event that happened, but the frequency signature of the stored emotion. For example, the unresolved grief. Observe also the involuntary reactions, like the eye movements, the shaking, the breath holding, when discussing specific topics, which indicate trapped energetic memories. Is the client stuck in survival frequency, that is guilt, fear, and anger? And this is a low vibrational loop that locks the physical body in a state of dis-ease. So here you are also observing the somatic states. Look for physical, mental, and emotional incongruencies. Use body scans to observe how stress is stored and manifested as symptoms in any part of the body. Also identify faulty pattern matching. Observe the recurring life patterns, the metaphors that indicate unconscious, limiting, or entangled beliefs. Also observe the client's behavior during the session, because this helps access their real-world functioning. And these behavior patterns look for self-sabotaging or limiting behaviors that keep repeating in the client's story over time. And here you determine if the client's daily actions align with their deepest values and purpose. Remember to acknowledge your intuition as you are doing this assessment. And your intuition is the observer. And it is a valid tool allowing insights coming to you that go beyond verbal data. And see those metaphor clients use to describe their reality because they mirror their internal state. And observe how a client's well-being is entangled with their broader social, relational, and environmental webs rather than being isolated to their internal psychology. So observe the entanglement with the environment and access where the client's energy is leaked or influenced. Does the client mention being trained by their phone, being trained by a specific person, or being trained by their workplace or community or congregation? Look out for the non-local stressors. Look beyond the physical body and assess the client's entanglement. Are they absorbing the stress of a partner? Are they absorbing the stress of the workplace? Are they absorbing the stress of any environment? Are they entangled with a dissonant external source? So after you have finished observing the physical aspects, that translates into the energetic signature. Now you define the problem statement. And this clear problem statement is the presenting problem that the client is coming with into therapy. And you clearly describe it, such as chronic fatigue related to blocked energy flow or anxiety due to environmental stress, depending on what it is you have gotten from your assessment. Then after that, go through the 5 P's formulation. You begin with the presenting problem. Then you go to the predisposing problem. What is it that predisposes the presenting problem? Then you go to the perpetuating factor. What is it that is perpetuating the presenting problem? Then you go to the precipitating factor. What is it that is precipitating the presenting problem? Then you go to the protective factor. What is it that is protecting the presenting problem from finding a solution? And then you also include quantum resilience, that is the ability for the client to adapt and recover from those disturbances. When that is done, the next step is to do a quantum summary of the key issues identified. Those themes that represent the client's current state. What is their dominant state of being? So you identify the dominant low frequency emotions like fear, anger, or guilt, or the high frequency emotions like joy and gratitude. And identify those issues that need to be addressed. For example, a client in fear needs frequency elevation. A client in anger needs coherence training. A client entangled with a dissonant external source needs field shielding or non-local detachment. That is cutting those energetic cords. And those that are heavy or dim need voltage or energy accumulation or exercises to raise their vibrational energy frequency. When all that is done, then you summarize your quantum need. And assessment concludes when you can define the primary distortion. For example, the client does not have chronic fatigue. They have a decoherence in their mitochondrial frequency caused by an informational loop of historical stress. Because the client might come saying that they have chronic fatigue. But after your assessment, you are going beneath the chronic fatigue to identify their energy levels. Mitochondria are energy stores. So we have finished the assessment. Now we go on to developing the quantum-informed treatment plan. So you are now going to create a customized non-invasive plan that addresses the observed imbalances. And a quantum-informed plan is fluid, prioritizing the client's role as the expert on their own life, allowing for sudden non-linear quantum changes. And treatment planning focuses on shifting the client's state from entanglement with old limiting rigid stories to a new, more expansive state. So we have to create a treatment plan that aligns with the client's unique personal energetic profile or unique signature and the client's values, their strengths, and their aspirations for a future healing to ensure commitment to the treatment. And this is when we come to setting the intentions. Targeting the future state or that probability, the specific future state that we aim to collapse into reality. The version of the client that we aim to collapse into reality. So unlike traditional rigid goals, quantum-informed plans focus on intention setting. Remember, the intention that you set is focusing the energy of your consciousness to some desired outcome. And where energy goes, where attention goes, energy flows. That is why we have to set the intention in quantum psychotherapy treatment plans. After you have set the intention, then you select the needed modalities and you select the quantum interventions that are going to be used to specifically address the client's needs that you have assessed. For example, you can do quantum breath work to alter physical or emotional stress to restore quantum coherence. Or you can use chakra balancing to remove energetic blockages. Or you can use visualization and meditation to rewire limiting subconscious beliefs. Then this will be the time now to create a personalized action plan that is tailored to the individual. And this is where you can include lifestyle changes. Suggest changes to support the client's energetic, physical, emotional balance. And this has to be integrated into their daily practices to maintain a high frequency energy. For example, grounding, sun exposure, or mindful eating. When we have implemented the treatment plan over several sessions, like 3 or 4, you might observe that the initial issues are being resolved. And you have to watch out for what the client's energy is indicating and where they need to go next. And this is where we do the monitoring, evaluating, and adjusting of the quantum treatment plan so that we continue with the process of healing our client. So by focusing on these 3 areas, assessment, treatment plan, and monitoring and evaluation and adjusting the treatment plan, you can create a treatment plan that addresses the deeper fundamental levels of a client's experience as we apply the observer effect. Where you place your attention, you place your energy. So today I leave you with this question. How have you understood making a quantum-inspired assessment of your client's needs and treatment plan? Let us meet next weekend. Have a blessed evening. Thank you, and thank you.